Welcome to Learniverse. Hope you all are fine. Today's topic is breast cancer. Breast cancer is deadly all around the world. Each breast contains 15 to 20 lobes of glandular tissue, arranged like the petals of a daisy. The lobes are further divided into smaller lobules that produce milk for breastfeeding. Small tubes, called ducts, conduct the milk to a reservoir that lies just beneath your nipple. Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. If left unchecked, the tumors can spread throughout the body and become fatal. After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States. But breast cancer doesn't just happen in women. Everyone is born with some breast tissue, so anyone can get breast cancer. Breast cancer types: invasive infiltrating ductal carcinoma (IDC). This cancer starts in your milk ducts and spreads to nearby breast tissue. It's the most common type of breast cancer in the United States. Lobular breast cancer. This breast cancer starts in the milk-producing glands lobules in your breast and often spreads to nearby breast tissue. It's the second most common breast cancer in the United States. Ductal carcinoma in situ. 3. Like IDC, this breast cancer starts in your milk ducts. The difference is it doesn't spread beyond your milk ducts. Triple-negative breast cancer. This invasive cancer is aggressive and spreads more quickly than other breast cancers. Inflammatory breast cancer. This rare, fast-growing cancer looks like a rash on your breast. IBC is rare in the United States. Paget's disease of the breast. This rare cancer affects the skin of your nipple and may look like a rash. Less than 4% of all breast cancers are Paget's disease of the breast. Signs and symptoms of breast cancer may include a breast lump or thickened area of skin that feels different from the surrounding tissue. A nipple that looks flattened or turns inward. Changes in the color of the breast skin. In people with white skin, the breast skin may look pink or red. In people with brown and black skin, the breast skin may look darker than the other skin on the chest, or it may look red or purple. A marble-like hardened area under your skin. A blood-stained or clear fluid discharge from your nipple. Change in the size, shape, or appearance of a breast. Peeling, scaling, crusting, or flaking of the skin on the breast. Changes to the skin over the breast, such as skin that looks dimpled or looks like an orange peel. Risk factors. Healthcare professionals know that breast cancer starts when something changes the DNA inside cells in the breast tissue. A cell's DNA holds the instructions that tell a cell what to do. In healthy cells, the DNA gives instructions to grow and multiply at a set rate. The instructions tell the cells to die at a set time. In cancer cells, the DNA changes give different instructions. The changes tell the cancer cells to make many more cells quickly. Cancer cells can keep living when healthy cells would die. This causes too many cells. Fried foods. Research shows that a diet high in fried foods may significantly increase your risk of breast cancer. Indeed, in a study involving 620 Iranian women under 50 years old, fried food intake was the largest risk factor for breast cancer development. Beginning your period at a younger age. Beginning your period before age 12 increases your risk of breast cancer. Refined carbs. Diets high in refined carbs, including the typical Western diet, may increase breast cancer risk. Try replacing refined carbs like white bread and sugary baked goods with whole grain products and nutrient-dense veggies. Alcohol. Alcohol use, especially heavy drinking, may significantly increase your risk of breast cancer. A family history of breast cancer. Beginning menopause at an older age. Beginning menopause after age 55 increases the risk of breast cancer. Obesity. People with obesity have an increased risk of breast cancer. Being female. Women are much more likely than men are to get breast cancer. Everyone is born with some breast tissue, so anyone can get breast cancer. Radiation exposure. If you received radiation treatments to your chest as a child or young adult, your risk of breast cancer is higher. Having your first child at an older age. Giving birth to your first child after age 30 may increase the risk of breast cancer. Having never been pregnant. Having been pregnant one or more times lowers the risk of breast cancer. Never having been pregnant increases the risk. Smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. Increasing age. The risk of breast cancer goes up as you get older. Added sugar. A diet high in added sugar may significantly raise your risk of breast cancer by increasing inflammation and the expression of certain enzymes related to cancer growth and spread. A personal history of breast cancer. If you've had cancer in one breast, you have an increased risk of getting cancer in the other breast. As such, it's best to reduce your intake of the following foods and beverages or avoid them altogether. Fast food. Eating fast food regularly has many downsides, including an increased risk of heart disease, diabetes, obesity, and breast cancer. Processed meats. Processed meats like bacon and sausage may raise your risk of breast cancer. A 2018 literature review of 18 studies linked highly processed meat intake to a 9% greater breast cancer risk. Stages of breast cancer. Stage 0. The disease is non-invasive, meaning it hasn't spread from your breast ducts to other parts of your breast. Stage 1. There are cancerous cells in nearby breast tissue. Stage 2. The cancerous cells have formed a tumor or tumors. The tumor is either smaller than 2 centimeters across and has spread to underarm lymph nodes or larger than 5 centimeters across but hasn't spread to underarm lymph nodes. Tumors at this stage can measure anywhere between 2 and 5 centimeters across and may or may not affect the nearby lymph nodes. Stage 3. There's breast cancer in nearby tissue and lymph nodes. Stage 3 is usually referred to as locally advanced breast cancer. Stage 4. Cancer has spread from your breast to areas like your bones, liver, lungs, or brain. How can I lower my risk? Get screened. Mammograms often detect tumors when they're too small to be felt. Cruciferous vegetables. Cruciferous vegetables, including cauliflower, cabbage, and broccoli, may help lower your risk of breast cancer. Cruciferous vegetables contain glucosinolate compounds, which your body can convert into molecules called isothiocyanates. These have significant anti-cancer potential. Get moving. Studies show that regular physical activity lowers breast cancer risk. Leafy green vegetables. These are just a few of the leafy green vegetables that may have anti-cancer properties. Kale, arugula, spinach, mustard greens, chard. Berries. Regularly enjoying berries may help lower your risk of certain cancers, including breast cancer. Antioxidants in berries, including flavonoids and anthocyanins, have been shown to protect against cellular damage and the development and spread of cancer cells. Peaches, apples, pears, and grapes. Fruits, specifically peaches, apples, pears, and grapes, have been shown to safeguard against breast cancer. In the large 2013 study mentioned above, women who consumed at least 2 servings of peaches each week had up to a 41% reduced risk of developing estrogen receptor-negative breast cancer. Fatty fish. Fatty fish, including salmon, sardines, and mackerel, are known for their impressive health benefits. Their omega-3 fat source, selenium, and antioxidants like astaxanthin may protect against cancer. Some studies show that eating fatty fish may specifically reduce your risk of breast cancer. Citrus fruits. Citrus fruits include oranges, grapefruits, lemons, limes, tangerines. Citrus fruits and their peels are teeming with compounds that may protect against breast cancer, including folate, vitamin C, carotenoids like beta-cryptoxanthin and beta-carotene, flavonoid antioxidants like quercetin, hesperetin, and naringenin. Eat a healthy diet. Some studies show a diet that includes vegetables, fruit, calcium-rich dairy foods, and lean protein may reduce your risk of breast cancer. Avoiding red meat and processed meat may also reduce your risk. Get to and stay at a healthy weight. This is a weight that's right for you. Ask a healthcare provider for information on setting up healthy weight management. Herbs and spices. Herbs and spices contain plant compounds that may help protect against breast cancer. These include vitamins, fatty acids, and polyphenol antioxidants. Avoid beverages containing alcohol. Research shows a link between breast cancer and alcohol. The American Medical Association recommends women and people of FAB limit alcohol to 1 drink a day. Walnuts. Walnuts have many benefits and are a great source of heart-healthy fats, including alpha-linolenic acid. Beans. Beans are loaded with fiber, vitamins, and minerals. Specifically, their high fiber content may protect against breast cancer. Fermented foods. Fermented foods like yogurt, kimchi, miso, and sauerkraut contain probiotics and other nutrients that may safeguard source against breast cancer. Whole grains. Whole grains like wheat, brown rice, barley, and rye are rich in important nutrients, including fiber, vitamins, minerals, and antioxidants. Thanks for watching. Subscribe our channel, and if you find this video helpful, then like and share it with your loved ones.